I'm Dr. Art Mollen.
And I'm Olivia Fierro.
Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. I'm Dr. Art Mollen.
And I'm his co-host, Olivia Fierro, not a doctor.
And we hope you're feeling good. We're going to motivate you, educate you, and advocate for your health.
It's what you do and do so well. And you always, anytime I get to talk to you, make me walk away saying, okay, Olivia, make a better decision today about at least one thing involving our health.
Absolutely. So what do you think on this new topic that we're going to talk about today?
Well, Dr. Art, I mean, I wouldn't know a thing about this, wink, wink, but I'm all ears and question marks and I don't know, maybe cheeks, who knows? We're talking about facial cosmetic injections. So obviously cosmetic dermatology, plastic surgeon's office, they're all over our community. Obviously this is huge business and as more and more people are, entering the ages of their 30s, 40s, 50s, 60s and on up, they're wanting to explore this. So tell me what you have learned about it.
Well, so I consulted a Dr. Dan Belkin, a dermatologist who's an expert in Manhattan in all of these types of fillers. So he gave me some specifics fillers that actually for different parts of the body.
Great.
So, I was just overwhelmed with his level of knowledge and it's certainly an area that I'm not familiar with. And, people ask me, have you ever used Botox? And I just always say, well, I don't inhale, so I mean, of course we all use Botox,
Yes.
I mean, it's something that we do. So Restylane is something if you have under the eyes and lips and you need injections in those areas, they use Restylane and Juvederm. So those are two of the keys that he suggested for, basically using fillers in those particular areas. The other one is Velour, and that's for the cheeks and also for what we call the nasolabial folds, and that goes from your nose down to your mouth. So that's one that he thinks is the best. Volux, Volux, and that's for the jawline. So if you
Hold on, I'm writing this down.
Yeah, so if you want to use something and get a filler for the jawline, then Volux is the one. Now, here's an interesting one because this is for the lateral face and the temples and in front of your ears. And I was not familiar with this one at all, and it's called Sculpture. And that's Sculptra. And that is, he says, is one of the best for the lateral portion of your face and the temporals. And then again, Botox, he said that's probably one of the most popular ones. And some of these other fillers actually stimulate the production of collagen. So that's how they work. And they work over a period of, maybe 3 months, 6 months. And some of them last for up to a year. He said that Dysport, which is Dysport, that's a competitor to Botox, and he thinks that that is particularly effective and maybe a little better than Botox in terms of being something that you can use on the forehead. I think the key with using any of these is finding a practitioner who knows what they're doing, and whether it's a physician, whether it's a nurse practitioner, a physician's assistant, whoever is giving those injections, you have to be very careful because sometimes they can leave lumps in different areas of your face. Also, if you put them down at like a Botox too far down, it can cause one of your eyes to close. And I've seen that in some patients. So all of these fillers and Botox included, as an injection, are not without risk at all. So you have to know what the potential risks are before you get into this, but make sure that you see someone who is an expert at giving these injections.
Yeah, and I think whether it's through television shows or in real life, we've all seen when this can go wrong. And it can, what's supposed to make you feel more returned to maybe your younger self or a little bit improved self can make you look like a different person.
Well, exactly. And then if we get into the area of cosmetic surgery, which, people will start with this and then they go into the cosmetic surgery and they can go overboard, and you have to realize, what are the reasons you're doing this? Is it because you want to look a little better on camera, like us? So that's one reason. Or are you just doing it because you're depressed? And I've seen it with patients who are depressed and they start going down the rabbit hole and they wind up getting one injection after another and they go back on a monthly basis. So you have to be careful of that as well.
And I like what we brought up about the different types and brands, because I think that's really important. This is something that's not a one size fits all. And so that's what you should be asking your practitioner if you're looking at doing this for the first time, is there's a reason why the experts would say you're not going to put the same stuff all over your face because it's different.
Exactly. And you may go to a different cosmetic surgeon or dermatologist who wants to use a different type of filler. And that filler may simply be one that he's more familiar with, and he can give you a better satisfaction of the end result than something else. So don't be too pushy with whoever the practitioner is that you're seeing. I think everyone has their own particular cosmetic filler that they want to use.
Yes. And I'm all for people doing whatever that makes them feel good. Because there's nothing like looking in the mirror and going, they start getting obsessed about something, you want to feel good. You just want to make the smart choices and make sure you're seeing somebody who is reputable.
Right. Just don't inhale.
Exactly. And don't go out of the country for this stuff, okay? Like, you wait and you get the good stuff.
Don't travel out of the country for it.
Let's talk about men. Should men be taking testosterone? And I'm flashing back to being at the gym over at the Lifetime and seeing, it felt like in all of the bathrooms and stuff, there was all these advertisements for, making it seem like every young guy in his 20s should be going and getting testosterone. It seems a little crazy.
Anabolic steroids, of which testosterone is one, have been around for years. And, we all remember Arnold Schwarzenegger, Mr. Universe and, and everything, and taking massive doses of steroids over the years, and all of these action figures that we see, have, amazing biceps and, pectoral muscles and things like that. So testosterone can certainly increase your muscle mass. No question about it. But a lot of men, and I've seen them come into my office and they say, can I take testosterone to increase my libido? Well, it will increase your libido, but the problem is once you start taking testosterone, it's going to suppress your natural production of testosterone. So you have to be careful of that. Is there a best form of taking it? Probably, an injection is going to be the best. It's going to be the most well assimilated and absorbed in the body than some of the others. Sometimes it's easier for men to get what's called, androderm, and androderm is just something that's applied to the shoulder. It's like a cream, and you just rub it on, and that one works, very, very well. Usually it's 10 milligrams with each pump because it comes in a dispenser, and that actually can help, but you have to use it every day. Now, sometimes they'll do implants with testosterone, and they will go into your hip, and they can last for months and months. So that's another form of testosterone. But overall, you have to realize there are side effects, and those side effects can be increase your red blood cell count. They can increase the risk of prostate cancer. It's been known to do that. Increase the risk of cardiovascular disease. And again, with any of these, I think you have to be careful how much you're taking. It has to be done not illicitly, buying them on the street, but through the advice and prescription of a physician so that someone can monitor you and actually take periodic blood tests, because it can affect your liver function studies. It'll affect all of those enzymes, and you don't want to have them elevate too rapidly and cause some liver problems. I think it's fine for men to take it, and they usually work. I think they plateau at about 3 weeks. So if you take the testosterone, you'll see a significant improvement in about 3 weeks, and that should be really effective. Increasing the libido, you may see it occur over a period of up to 6 months. So there may be other reasons, but when it comes to testosterone, caveat emptor, Latin for buyer beware.
Well, and once you start that, is that then forever? I mean,
it can be forever, and that's the problem with it. And that's what I always advise men. If you start taking the testosterone, you probably are going to have to continue to take this, or your natural production of testosterone is going to fall. And what you have to understand is your testosterone level will start to decrease 10% every decade after the age of 40. So that's another factor that you have to, take a look at. And if you have a loss of libido, it may not even be your testosterone level. Have your testosterone level checked before you start taking testosterone, whether you take it, from your doctor, or if you're buying it, online or something like that. So, and I always caution that, because you never know what you're getting if you're buying it online.
And it would be good to have a baseline of what your levels were.
Absolutely.
Ideally,
yes.
pre this, where you all start going downhill.
Exactly. And again, there are criteria. The testosterone levels can vary between 200 to 900. That's the range when you take a simple blood test.
Okay.
And if it's
it's a big range.
It is a big range. And if it falls somewhere, and then there's free testosterone, and that has to be measured as well. So get that blood test. Determine what your testosterone level is. If it's closer to 200, yes, you need testosterone replacement therapy. If it's up around 800 and you say you have a loss of libido,
time for talk therapy.
See a psychologist.
Exactly. And I don't mean to belabor this, but it is so interesting to me. What's the deal with the redness in the skin? I know it seems like when men are on
and it increases your red blood cells. So that's why
that actually is showing.
Yes, so you have to have a hemoglobin, basically the oxygen carrying of your component of your blood, and that can basically elevate. So you want to have a hemoglobin. Normally it's around 16. I've seen some men have hemoglobins up to 20, and that's what causes the redness. Or you'll see their face blanching out. It's very red, where I remember one individual years ago, he almost looked like a cyclops. He had so much testosterone that he'd been taking for such a long period of time.
Yeah. And it doesn't look natural.
Yeah.
Right?
Be careful.
Yeah. Okay. And now an very interesting topic that a lot of people are discussing, because we've seen major law changes surrounding this, and it is a cultural shift that can be hard to adjust to. But the topic is marijuana safer than cigarettes, comparable to cigarettes? Obviously, we know cigarettes aren't safe. So
sure.
How do you view this topic, long-term effects, all of that?
Yeah, so the perception is that smoking marijuana is safer than cigarettes. It is not. It can cause emphysema. It can cause chronic obstructive pulmonary disease, just as easily. We often don't know what strength of the marijuana that we're getting. If you're buying it illicitly, then there's even more reason to be concerned. Marijuana is legal in 37 states, but it's not federally legal. So that's another concern if you're, traveling from one state to another. So you have to be careful with that. I'm always concerned with people buying the marijuana illicitly. I'd rather have them go to a dispensary, and the dispensaries have different strengths. So if there's one that's has a more potent level, of marijuana than another, that's an issue. So I think with marijuana, it's definitely not any safer than cigarettes. On that same token, if you smoke cigars, they have, 10 to 20 times more nicotine in it than actually cigarettes do. But with the marijuana, there are side effects. You can lose your motivation. You can. It's going to probably increase your appetite a little bit, so you could potentially, gain some weight. Can it help anxiety? It potentially can reduce your anxiety, no question about it. Can it cause some depression? I think with depression, again, there's so many factors involved, but sometimes people will smoke it and they find they get more depressed, and they lose their motivation, and that's why I really, caution any young kids out there, not to be smoking marijuana. They're going to lose their ambition. They're going to lose their desire to achieve things, and their goals, could be kind of, stunted as they move forward.
If we're thinking about the lung health and the risks there, is vaping actually a better alternative, or is that a myth?
So when vaping first came out, they said, "Oh, this is a great alternative. You're going to stop smoking."
I'm sure they said that about cigarettes originally. Very healthy
right,
for you.
Exactly. It's going to be something that's great for you, and you're going to stop smoking cigarettes. But the only thing that vaping does, it doesn't contain the tar that cigarettes have. So vaping may be a little bit better from that standpoint, but overall, vaping is not any safer, and it can potentially be addictive, and it can lead to, again, smoking marijuana or taking other types of illicit drugs down the road. So I don't think the vaping is something that is going to replace it, nor is it going to help you to stop smoking. If you want to stop smoking, get a prescription for Chantix or Wellbutrin or other medications that are out there. Those medications can be quite effective.
Yeah, don't want to swap one bad habit that you're trying to break for another.
Right.
Dr. Mollen, thank you. We've got some questions from viewers coming up for you.
Okay.
So is the doctor ready?
I'm ready to go into the clinic.
It's 2024 and the doctor is in, and we want to be feeling better than ever this year, Dr. Mollen. So what are your thoughts as we all kind of, embrace those resolutions, and then sometimes we forget them by January 7th, 8th, 9th, or 10th?
Right. If they're really fortunate, they forget it by then. But generally, New Year's resolutions are usually broken within the first 7 days of the year. No question about it. And maybe that's why people make New Year's resolutions, so that they can break them, whatever they are. I mean, I think it's often losing weight. I mean, I think that's one of the main priorities. I always suggest people, of course, stop smoking and start some type of exercise program. If you want to lose weight, then the only way you're going to lose the weight is to cut back on the food intake, because that's 90% of losing weight. Exercise is probably 10% of it. But making New Year's resolutions, I think, in terms of having a positive mental attitude, I think that's one that I often emphasize with my patients. Just look at life differently. Be grateful for what you have. And if you're not feeling super healthy, well, you feel pretty good. Just be grateful for that, and then just try to improve on that. And whether it's through changes in your lifestyle and your exercise and your diet and stopping smoking. And, I think alcohol consumption is really a big issue in today's environment. And I think people ought to just try to cut back on their alcohol intake. And, if they're drinking every day, do it every other day. That's a good start to it. If they're drinking every other day, go to every third day, or just make it once a week, and don't think that binging on the weekend makes it any better than not drinking at all during the week, because that's a problem as well.
Okay. So any little changes we can make, and kind of set yourself up for success, right? Make things manageable.
Exactly. And it's exactly what you just said. Little changes, take, baby steps in terms of making these changes, and whether that's the stopping drinking the alcohol, but don't make those resolutions that are too great that you're going to fail. Make small steps and go forward with those, and then you can increase those steps as you go forward through 2024.
Yes, we wish you well in all the ways. Okay, I've got a question for you from a viewer named Heidi. My eyes are continually burning, stinging, and feeling gritty. So what's the best treatment, and will fish oils help?
Yeah, so there are a lot of factors with dry eyes, and you want to make sure you don't have an autoimmune disease called Sjogren's. Sjogren's disease is an autoimmune disease. Dry eyes is one of the common problems with it. You can use the artificial tears. That's one treatment for it. There's meibomian glands in your eyes, and these are little tear ducts right in there, and those glands actually, cause the, basically dry up, and so they can insert tubes in there if it gets really to the point where you need surgical intervention. But generally, the artificial tears will work. Restasis is a prescription medication, and that works quite well. There are not any over-the-counter medications, that they substitute for Restasis. I think that's an excellent drug, but it is kind of pricey. So you have to try to make sure that it's going to fall within your budget if you do something like that. The other thing is environmental factors. If you have allergies, if the heaters are on in your house, all of these things can cause dry eyes. And I think that's what you have to be concerned about in terms of treating this condition, and basically, trying to prevent it as opposed to just finding a treatment for it.
Okay. Presley asks, is there any cure for belly fat? And I just feel like I heard anybody listening at home stop and perk up with all ears.
Yeah, well, the major treatment that is basically, you want a six-pack, then avoid the six-pack, so that's the first thing.
We'll take a four-pack. I take a two-pack.
Yeah, so I think what you have to do is basically, just reduce your calorie consumption. There are muscles under there. You can do 1,000 sit-ups a day, and it's not necessarily going to give you a six-pack. And if you have belly fat that basically overlies that muscle, then you're not going to get that six-pack. So I think, again, you have to lose the weight, and, whether that's losing 5 pounds, 10 pounds, whatever you have to lose, to get rid of the belly fat. But, outside of liposuction, which of course is a surgical intervention, and I don't recommend that.
The reality of it is you can't target that fat loss as much as we might like.
Comes off the whole body.
Mm-hmm.
It comes off your hips, comes off the buttocks, all of those areas, are going to lose the body fat, and it'll come off the abdomen. And unfortunately, it comes off the abdomen more slowly. I find in men, they often develop more of the body fat in the belly area. Women develop it more in the hips and the buttocks.
Mm-hmm. It is true. What can we do?
You don't have to worry about that.
Sure.
You're
perfect. Just keep the camera far, far away. Okay. How about GERD? This is something, especially where people are coming out of the holidays,
sure.
and they've been eating and having lots of sweets, and there's just certain things that can trigger it for people, right?
Yeah, no question about it. So GERD is gastroesophageal reflux, and basically if you have that type of reflux, and indigestion when you're eating certain foods, or you get a burning sensation, again, foods can be a precipitating factor, but you have to make sure it's not something like Barrett's esophagus. You need to have a barium swallow if you're having it on a regular basis. You may want to have a CAT scan of the abdomen, as well, to make sure that there's no other underlying tumors or anything, much more serious. Over-the-counter remedies, something like Pepsid, can certainly help. These H2 blockers that they often refer to, they've been around for quite some time. Dexilant is a prescription medication. That's one that I often recommend for people, to take. A natural remedy is called turmeric, and that's Tumeric. And turmeric is an Ayurvedic medication. It's kind of an anti-inflammatory, and that's something that people could try, to see if that helped to reduce some of that inflammatory. But generally, avoid the spicy foods, avoid the garlic, avoid some of those foods that are going to precipitate it, and try to look for an underlying, more significant cause. It needs to be evaluated. If you're having it over a period of, say, several months, then see a gastroenterologist.
I know a lot of people who have that if they ever have chocolate. It seems to do something too.
Yeah, chocolate, as far as aggravating it,
Mm-hmm.
no question about it. Caffeine is another, significant factor. Smoking is another factor with gastroesophageal reflux, and of course, alcohol.
Okay. Very good questions. These are really relatable for a lot of people. We also want to be checking in with the family because it's family medicine time, Dr. Art Mollen. So Denise needs to know, what vitamins and minerals do you suggest taking daily? Now, I don't know if she wants to follow your exact routine.
Yeah. So my exact routine is no vitamins, and people always
Really?
ask me this.
Think of the endorsement deals you could have had over the years.
I know.
He's open to change.
I mean, I I researched vitamins extensively when I was running in my younger days, running a lot of 26-mile marathons, looking for something that was going to get me to win the Olympic marathon. I would have been taking all the vitamins and maybe even steroids if I thought I could have won the Olympic marathon. But, in reality, if you're eating properly, I think you're getting sufficient vitamins and minerals from what you're consuming. So if you want to take a multiple vitamin, I suggest a multiple B vitamin. You can take vitamin A, D, and E. Now, A, D, and E are water or are fat-soluble vitamins. So they're not like the water-soluble vitamins, which is vitamin B and C. So if you consume excessive amounts of vitamin Bs and vitamin C, you're probably going to excrete those in your urine. So you're going to have very expensive urine, but you're not necessarily going to increase your overall energy level. So vitamins A, D, and E, be careful because they can potentially be toxic if you're taking too much of them. With vitamin D, your skin will synthesize vitamin D from just being out in the sunlight for 10 minutes or so. And the vitamin E, you could take 400 to 800 international units a day, and that's a reasonable amount of vitamin E to be taking. And the multiple B vitamins, you can take any one of those multiple ones, which, will include the vitamin B1, B2, B6, and vitamin B12. If you have anemia, then you can supplement with 1,000 micrograms of vitamin B12.
B12. Okay. Do you take a probiotic?
I do not take probiotics, but probiotics are certainly beneficial for people who may have any type of bowel problems, and that can help with absorption as well.
All right. Okay, Denise, you're set. We're saving some money too because we're not going to be buying every single vitamin that I see advertised, which is I'm a sucker. I'm like the ultimate consumer. Oh, I need that. Oh, I need that too. Okay.
Yeah. Call me the next time you're buying them.
I will. Jeremy is asking Dr. Art Mollen, how many calories should I eat daily to try to lose about 15 pounds? Jeremy is family, so but for our listeners, 50 years old and weighs about 150 pounds.
Yeah, so for Jeremy, what I suggest is consuming a diet that's going to maintain his weight. So he wants to maintain his weight. You take a simple number, 15 times whatever your weight is. So for Jeremy, he weighs 150 pounds. If you multiply that by 15, that's going to equal 2,250 calories a day. If he wants to lose weight, then he needs to reduce that amount by 500 calories a day. 500 calories a day equals 3,500 calories in a week, and that equals 1 pound. So 1 pound is 3,500 calories. I don't want to tell you how many miles you have to run, but that's 35 miles that you'd have to run to burn up.
To 1 pound?
For 1 pound. So 3,500 calories equal a pound. So for Jeremy, he can follow that simple rule. And again, if he reduces his calorie intake by 500 and then adds exercise and burns another 500, now he's going to be up to 2 pounds a week. And 2 pounds a week on a weight loss would be excellent. For women, they should take the number 12 times their weight. For instance, you weigh probably 100 pounds. So for you, that would probably be about 1,200 calories a day. Now, if you wanted to lose weight, which you don't need to lose weight, but if you wanted to, reducing it by, say, 500 calories a day, that would be, an easy weight loss.
It doesn't sound so easy when you break it all down like that. That's a lot of work for a pound.
Yeah, so it does seem like a lot, but if you schedule that over the course of a year and you lose 2 pounds,
Dr. Mollen,
you lose 2 pounds a week?
Deluding yourself that we have patience? You have patience and patience. We have no patience. We want these results right away.
I know. Everybody wants the quick fix. But don't reduce your calorie intake below 500 calories a day. When people get on very low calorie diets, it slows down their metabolism. So you don't want to reduce your calorie intake too much, because if you slow down your metabolism, then it's going to be even more difficult to burn calories that you're consuming.
Jeremy, you got us talking. That was a good question. So this one is coming from Fran. Fran says she has osteoporosis, and her doctor has suggested that she takes daily calcium and vitamin D. but she would prefer maybe exploring eating yogurt or cottage cheese instead.
Yeah, well, cottage cheese and yogurt, they both do contain certain amounts of the calcium. The vitamin D, I always suggest people, you can take 400 to 800 units a day. That's fine. With the calcium, I really think that taking a calcium supplement is fine for people who are not eating adequately, whether it's calcium or yogurt. They both contain about 150 milligrams of calcium a day if you were consuming some calcium or yogurt in a cup, but you could take a calcium supplement up to 1,000 milligrams a day. That's adequate. Just make sure you're not taking too much calcium. It can potentially cause calcium oxalate stones, which are potentially, could be kidney stones, and that could be a problem. So you have to be cautious of that. I think, probably eating the kale is a good source. Kale, I like kale better because it's a fiber, and that contains almost 200 milligrams of calcium. So the leafy green vegetables have calcium, and a lot of people don't realize that.
And is calcium deficiency more of an issue for women, it seems, than men? Or is that
it can be more of an issue for women who experience osteoporosis, and particularly if they're taking different medications. Prolia is one of the medications that's often, being taken by women for osteoporosis. And so when you're taking those medications, then you have to usually supplement with vitamin D and calcium.
Oh, it is so nice to have a little session of family medicine because we all benefit from it, whether we're in the family or not.
Well, you're in the family.
Thank you. In the family
you're part of my family.
We're feeling good.
So I'm Dr. Art Mollen, and I hope you have a happy and a healthy new year, and hope you're feeling good.